parents had anything together, they will always have SS. So now, for instance, maybe they don't know, because they don't know what are the traces of a child that even without going for any clinical
Okay.
this thing, you will know that okay,
That child
this child
has.
has a
Okay.
is SS.
Majority of the sickle cell kits that we have these days are product of lab errors,
Okay.
whereby the mother already knows that she's AS, or the
Yes.
father already knows that he is AS, and the other part is AA. Eventually, the child falls sick. Crisis starts from the onset, from the very tender age, maybe from 1 year above, when the child stops sucking.
So if the child did not stop
So you
talking
now
till two
see you
years,
might
it will
not
show.
know,
Wow.
because the immunity the child gets from the breast milk might not give the cells the breaking downs of the white blood cells and the likes. So the child might not be having crisis that you think. It
Okay.
might just be little little things like, oh, the child wants to grow teeth,
So
maybe
believe
teething. So it
regular.
might just be that the regular thing, but
Yes.
there are some symptoms in baby that maybe the swollen palm, the swollen foot, when normally a child is not supposed to be having water retention in the feet
Sure.
like an adult.
Yes.
So when you start saying that, that is part of the traces. And then because of shortage of blood that we do have, like normal person with AS or AA, what they do have is that every 20, 15, 20 days the blood, they reproduce blood, but we don't reproduce blood. So what happens is that when you are reproducing blood, we are just living with the supplements or whatever we have been taking to keep that blood. So that is why you see that most sickle cell patients are being transfused. When your normal percentage of blood PCV is around that 45 and above, hers doesn't go up to 30. In short, if you see a sickle cell warrior that has a PCV over 30 and above, just give that person a twirly. Do you understand? So
Yes.
they are part of the things that you will see or notice in a child. You see their yellow eyeball, which has to do with
But your eyeball is not
jaundice.
yellow.
My eyeball used to be yellow.
Okay. Yes.
And
Yes. It
whenever I am
is.
stressed, you see it, or whenever I'm having crisis,
So even
you see it.
no matter how you are managing it, the eyeball will be yellow.
It will still, it clears off.
Okay.
It clears off. It might be part of stress.
Okay.
It might be, yeah, you understand, exhaustion or dehydration. Do you understand? So you have that eyeball, yellowish eyeball, you have a pale lips, you have pale palm. Whenever I am in crisis, that is when you notice all these things. I'm saying particularly about
You.
me. Then
Yes.
that is part of the traces that you see. Then you see a child having a swollen tummy.
But it's kwashiorkor that used to cause so
No,
little
no, no,
now.
no. There's
Okay.
something they call enlarged spleen.
Okay.
I learned that abroad, whenever they get a child that has that, they operate on the child
Okay.
and take it off. But here, mm-mm. I lived almost all through my childhood till I grew up with the name Ominukun, because I had it too. I was not this big. I was very
Okay.
tiny and I
Is
had a
your
tummy.
body this and I just hide everything now?
Well,
That
I
makes
don't have
sense.
it now anymore because
Okay.
I have outgrown it. Like you said, there's nothing like,
How is it with how what should they expect?
ah,
And how should they expect to face how did we expect them to face the challenges and how to come out of it?
from experience, it's not always easy. I can say it. I got married at 32. It's not even an issue. But I tell you, sickle cell patients hardly find love. I have a particular project ahead of me that I just want to bridge the gap between AA and sickle cell. That we are people you can marry. We are not just a statue. We are humans. We reproduce. We are fertile. Do you understand? So, but before you see, in this our setting, parents hardly allow their kids, their children, to get married to a sickle cell patient because they believe that kò ní pẹ́ kú. And besides, there are a whole lot of sickle cell warriors that have one complications or the other. So our sickling agent, like it is not, it varies from one sickle cell patient to the other. Crisis varies from one sickle cell patient to the other. You have some sickle cell patients with leg ulcers, with wounds in their legs. So such a person, you not expect the guy to take her home and the mother will accept just like that. So with prayers and love, we find love, a genuine love. That is only when we exist as married. But when you have parents that says my child cannot marry this, my child cannot marry that, my advice for parents, please, oh, with God on our part, if your child is AA, we are good to go.
Okay, can you hear that? Can you hear that, everyone? So, in case your child bring out, okay, this is what I want to marry. This is my wife. This is my husband. Please, all because they have sickle cell does not mean they can't produce. They can't give you your grandchildren. They can't give you a family
Healthy
that you
children,
want.
yeah.
So please, if you know, maybe you have a fiance, just know that okay, this person is sickle cell, and you are a please. We are, she's saying it, she's part of, she's a testimony to say they are good to go. Wow. Well done, ma. Seriously, this is wonderful. Well done. So, ma, let's go to another phase of my question. Talk of childbirth. You know you don't have strength. According to what you're saying now,
Yeah.
sickle cell, they don't really have strength. That
Not
strength.
that we are weak.
You know that you're weak, but you don't
We
have
are
the
strong.
you are strong. Okay, okay, you
We
are
are
strong.
sickly.
Yes.
Uh-huh.
How is it? Because that labor room have been there.
Okay.
So does that mean anybody with sickle cell, they should just go for CS? Maybe.
No, no. We actually have testimonies of sickle cell patients or sickle cell warriors that give birth naturally. Not once, not twice. And we have ones that had multiple births too, that gave birth naturally. I gave birth through CS, not because I wished to, but because I already had an implant in my pelvic
Okay.
prior to the time I was pregnant. I
Okay.
had my surgery 2017 and I had my child 2019.
Oh, yes.
Pregnancy, it is actually not a joke.
Yes.
But with God, even somebody that is not sickle cell, pregnancy is not a joke.
Oh,
But there's
yes.
something I want to tell you about this labor pain. The labor pain, the natural labor pain that ASAA goes through whenever they want to give birth, is actually what a sickle cell patient go through as a crisis.
Eh?
Yes.
That one.
That pain that you go through as
Yes.
A or AS, that okay, push after you finish giving birth.
Well, okay.
Ọlọ́run máa ń fi ìgbàgbé sí
We are
àbí,
good
you
to
forget
go.
about it.
Yes.
That same pain is the same pain we go through in an episode of crisis, and our crisis lasts at least for 5 days. We have that for 5 days. We have months. We have years. We have things like that. So that pain that you're talking about, the labor pain you're talking about, is the pain that we go through naturally when we have bone pains.
So they won't be
So
surprised if that
our
pain
pain threshold, yes, do you understand? So when the warrior wants to give birth naturally, it doesn't sound like pain like you think. I'm not saying it is not pain,
Yes.
but your percentage of pain, your pain threshold is different from mine. Do you understand?
Yes, I understand
So
you.
if I never had my surgery before I would tell the doctor I want to try.
Because you are not new to the pain.
Yes.
So does that mean that there is, no matter all these supplements you use, once in a while you still go through crisis?
It is compulsory. In short, it is a no thing that
So
you,
we should not
you
expect that
always
for
go
anybody
through
for
crisis.
any sickle cell, no matter how the supplement, even if it's just once in a while, you have that crisis.
You have crisis.
Oh, wow, okay.
Crisis is just part of your body telling you that there's something wrong.
Okay.
So crisis will always come, but it differs. It varies from one sickle cell patient to the
another.
other.
Okay.
I might be having bone crisis often on my leg, and another warrior will be having that of the chest, acute chest syndrome. Another warrior will be having leg ulcer. Another warrior may be having avascular necrosis. Another warrior might be having kidney or liver issues. And meanwhile, majority of our drugs that we take, our routine drugs, had effects on our kidney, our lungs, and heart.
But you don't have to. You have to take it.
But we have to take it. And I'm not trying to say it is just that drugs that keeps us. But I'm trying to say with the help of God and the drugs to manage.
Yes.
Do you understand?
Yes.
So I tell people there are times that we get tired of taking drugs. I used to get tired of it at times. I might not take it for days. But what used to move me is that I'm an advocate of. When any parent calls me now that their child, what do I tell the child? When even me,
You're not taking
I'm not
yours.
taking my drugs. And whenever I don't take my drugs, I know what happens. Sure, you understand? So
Yes,
crisis is certain. It will come. But
Okay.
it might not be like everyday thing that some other warriors used to have. So that's why I said it varies.
Okay.
My own kind of crisis might
It's
not
different
be
from another warrior.
kind
Okay.
of crisis
Okay. Yeah. Thank you.
to go in the life of that child. we tend to flourish and grow bigger, better when we live in love.
Okay.
When we feel that we're being loved, we're not being stigmatized by the so-called parent that brought us to this world. There are times that it might not be our parents that is our caregiver. It might
Yeah.
be our brothers,
Family.
our
Yes.
families. It might be distant. It might be somebody that are not even related to
Yeah. Sure.
us.
Sure.
So I used to tell them in the clinic anytime I am opportune to talk to parents with younger ones. I said, see, management is key. Make sure your child is not dehydrated. Always with water. You can see I came in with water, and you make sure that your child does not overstress as his or herself, and make sure that their routine drugs is normal, and you have a positive mind about this person. And I tell them, always declare and decree upon your child, you will be the head and not the tail. You go places, not that one that think omo yen ò ní pẹ́ kú. Like somebody told my daddy one time like that. I keep saying it. Omo you ò ní kíje. Like I won't grow up to 8, 7 years.
And
And
now
when
you.
the person died, I wore my Christmas clothes to go and dance, and I brought in pop off, as in ajeyu at ajesheku, because I felt that
Yes.
that person does not have the final say over
Over.
my life.
Yes.
You understand? But my father never gave up on me. And the same thing I tell parents with sickle cell. My father always encouraged me taking drugs. He takes vitamin C2 every day. Say, "Wah, you want to call Onishoro? You see, you're taking drugs. I'm taking drugs too." So for me
To
to have
encourage
to
you.
encourage me to take,
Yes.
not that wala ti poju. Oh, sorry. People used to say sickle cell patients or warriors are very stubborn. Yes, I see where it's coming from, because I believe in something. Even my child that is not even a warrior, you can't tell my child you can't. She will tell you I can,
Yes.
because she wants to do what you said. So whatever you want to tell me not to do, marry, Joe, don't walk in the rain, because you have ugu, moringa, uziza, everything. So those things, then I used to complain, is it by force that we cannot eat white rice in my house without leaves, without
Meanwhile,
chocolate?
it's helping you.
So I never knew it was actually helping me, because it was giving me more than I ever wanted. Fruits are well okay for us, but when you start giving us rice every time, rice, carbohydrate every time, so particular a particular type of food, it might not go well with whatsoever supplement. So those supplements we are taking actually are serving as, if you cannot have a good diet,
Oh,
it works.
thank you. So this is mine for the parents, guidance, and caregivers of warriors out there. So in a brief, in just 30 seconds, what can you tell the society? What did you advise the society to do?
Please, society, accept us for who we are. A lè ṣiṣẹ́, a kì í ṣe alápámá ṣiṣẹ́. A majority of us, like an adage, Ọlọ́run ò kí ń pa àfáà lórí kó má fi irùngbọ̀n dì. We used to be very brilliant if it comes to educationally, and if it comes to skills, we used to be very good in whatever we do. So we are open to work. Please employ us. Please give us work. Don't see us as we are dying soon. We are not dying anytime soon. Don't see us as if we cannot do the daily tasks. We can. Please give us chance
So
to
that
explore.
is it for today. I know you really enjoy. That's why we didn't have call, because people are like they just listening well, because because we have just break some important information we're supposed to achieve today. So seriously, sister Folake, I really appreciate.
Thank you.
Thanks for coming out, because a lot of people be like, I don't want people to know I'm this.
Why?
Thank you for coming out to encourage those that are still having difficulty in coming out to speak up. God bless you for that. So see you again next week, same time on Ilaji 91.9 FM. I'm still your humble host, Sekinat Hammed, the founder and the Chief Responsibility Officer of Network for Inclusion of Persons with Special Needs. Thank you.